15 embarrassing side effects of prednisone we don't talk about. Every day, thousands of people rely on prednisone, a corticosteroid medication that can be life-changing and in many cases, life-saving. Whether it's for autoimmune diseases, asthma, inflammatory bowel disease, allergic reactions, or even cancer, prednisone plays a vital role in reducing inflammation and suppressing the immune system. But as effective as it is, prednisone comes with a long list of side effects, some of them visible, some invisible, and some that are just plain embarrassing. Today, we're opening the door on 15 embarrassing side effects of prednisone that are rarely talked about, not to scare you, but to help you feel seen, to give you clear explanations for what's happening in your body, and to remind you that you are not alone in this experience. Before we begin, a quick disclaimer. This video is intended for informational and educational purposes only. All content has been fact-checked using reputable medical sources, which are linked in the description. If you or someone you love is on prednisone, please consult your healthcare provider before making any changes to medication or lifestyle. These side effects do not define your worth, your strength, or your journey. Now, let's break the silence. 1. Facial swelling, moon face. This is one of the hallmark signs of prednisone use, a rounded, puffy face that can develop gradually, often taking patients by surprise. The term moon face refers to the characteristic facial swelling caused by fluid retention and fat redistribution. Prednisone causes the body to hold on to sodium and water, and at the same time, it shifts where fat is stored, often depositing it in the face, upper back, and neck. This is primarily due to the medication's influence on mineralocorticoid receptors, which regulate fluid balance and its impact on metabolism, leading to changes in fat storage patterns. The result is a fuller, rounder face, which can make someone look drastically different from their usual appearance, sometimes quite suddenly. What makes this particularly difficult is that it doesn't reflect lifestyle or diet choices. It's a physiological response to the drug. And yet, people often receive unsolicited comments about weight or appearance, or even inquiries about their health, which can feel deeply uncomfortable and invasive. The visible nature of moon face often acts as an unwilling public announcement that one is on a strong medication, leading to feelings of self-consciousness and a perceived loss of privacy. 2. Weight gain, especially in the abdomen. Prednisone doesn't just increase appetite, it supercharges it. Many users describe an intense, persistent hunger, including cravings for sugary, salty, or carb-heavy foods. This increased appetite is believed to be due to prednisone's influence on the hypothalamus, the part of the brain that regulates hunger and satiety. Combine that with the metabolic effects of the drug, such as insulin resistance and changes in fat storage, and weight gain becomes almost inevitable for many people. Prednisone can reduce the body's sensitivity to insulin, meaning more insulin is needed to manage blood sugar, which can promote fat storage. What's even more distressing is the pattern of weight gain. It tends to accumulate centrally, primarily in the abdomen, upper back, leading to a distinct buffalo hump, neck, and face. This isn't just cosmetic. It can lead to significant body image issues, restricted mobility, discomfort in clothing, and profound frustration, especially when people are doing their best to eat well and stay active but still see the numbers on the scale climbing. The disproportionate fat distribution can be particularly upsetting as it alters one's familiar body shape. 3. Acne and skin breakouts. Teen-style breakouts in adulthood? Unfortunately, yes. Prednisone ramps up oil production in the skin, which clogs pores and leads to acne, sometimes quite severe. The medication can stimulate the sebaceous glands, leading to an overproduction of oil that creates a fertile ground for bacteria and inflammation. For some, the breakouts appear not only on the face but also on the chest, back, and shoulders, often presenting as large, painful cystic pimples that resist usual over-the-counter treatments. This can be especially tough for adults who've long since left their teenage acne behind. It can feel regressive, embarrassing, and even professionally challenging. And because prednisone also slows wound healing and suppresses the immune system, these pimples may take longer to resolve, be more prone to secondary infection, and leave behind persistent dark marks or scarring, further impacting skin appearance and self-esteem. 4. Excessive sweating, steroid sweats. Unprovoked, intense sweating is a well-documented side effect that can feel incredibly disruptive. People may find themselves waking up drenched at night, requiring a change of sheets, or sweating through their clothes during the day, even in air-conditioned rooms or during minimal physical activity. This isn't just typical perspiration, it's often described as sudden, drenching, full body, and relentless, particularly around the scalp, neck, and torso. The exact mechanism isn't fully understood, but it's thought to be related to prednisone's effects on the hypothalamus, which also controls body temperature and its overall impact on the nervous system. The unpredictability of these episodes adds significantly to the embarrassment. A calm conversation can suddenly turn into a visibly sweaty moment, leading to social discomfort, anxiety, and a constant worry about body odor or appearance. It can also lead to a reluctance to engage in social activities or exercise out of fear of an unmanageable sweating episode. 5. Hair thinning or unwanted hair growth. Prednisone can throw off the body's delicate hormonal balance, particularly affecting androgen levels. For some, this leads to hair thinning, especially on the scalp or eyebrows, where hair might fall out in clumps or gradually thin over time, leading to noticeable patches or a less dense appearance. This can be particularly distressing as hair is often linked to identity and vitality. Conversely, others experience excessive hair growth, known as hirsutism, particularly coarse, dark hairs appearing on the face, upper lip, chin, chest, back, or arms. This is often due to the androgenic effects of the corticosteroid. This can be deeply distressing, especially for women, as it challenges societal norms of female appearance and can lead to frequent, time-consuming, and sometimes painful grooming routines, causing significant self-consciousness, shame, and a feeling of being less feminine. It's worth noting that both effects, thinning in one area and growth in another, can sometimes happen simultaneously in different parts of the body, adding to the perplexing nature of this side effect. 6. Emotional volatility, mood swings, and irritability. Prednisone doesn't just change how your body looks, it can change how your mind feels. It interferes with crucial neurotransmitters like serotonin and dopamine, which play a major role in regulating mood, emotions, and stress response. Prednisone can also affect the hypothalamic pituitary adrenal (HPA) axis, the body's central stress response system. Many people on prednisone report intense mood swings, ranging from euphoria and increased energy, sometimes called steroid high, to profound irritability, anxiety, and sudden crying spells. Some describe it as feeling emotionally unhinged, reacting to situations more strongly or inappropriately than usual, experiencing disproportionate anger or sadness, and then feeling immense regret, guilt, or confusion afterward. This can strain relationships with family, friends, and colleagues, lead to misunderstandings at work or home, and cause significant internal distress. It's vital to remember, however, that these are drug effects, not a personality flaw or a reflection of one's true character. 7. Insomnia and restlessness. Prednisone can create a kind of hyper-alertness that makes falling asleep and staying asleep a real challenge. Prednisone is a stimulating hormone, similar to cortisol, our natural stress hormone, and taking it, especially later in the day, can interfere with the body's natural sleep-wake cycle, circadian rhythm, and make it incredibly difficult to relax, quiet the mind, and fall asleep. Users often report racing thoughts, vivid or disturbing dreams, frequent awakenings throughout the night, or waking up feeling like they never truly rested. Over time, the chronic sleep deficit can worsen mood issues, reduce cognitive performance, heighten emotional sensitivity, and exacerbate fatigue during the day. This creates a frustrating feedback loop. The medication causes insomnia, and the insomnia amplifies other side effects. The inability to sleep when others are resting can also lead to feelings of isolation and deep frustration, particularly if attempts at sleep hygiene prove ineffective. 8. Swelling in hands and feet. That uncomfortable tightness in your shoes, rings suddenly not fitting, or the feeling of heavy, swollen limbs? It's likely due to fluid retention, another hallmark of prednisone use. The drug causes the kidneys to retain sodium and water, leading to noticeable peripheral edema or puffiness in the hands, feet, ankles, and lower legs. This occurs because prednisone acts on mineralocorticoid receptors in the kidneys, leading to increased reabsorption of sodium, and water follows sodium. And while it might not seem as serious as other side effects, it often causes significant body image distress and physical discomfort. It can make walking, writing, gripping objects, or even wearing familiar clothing much more difficult. The constant feeling of being puffy or bloated can be demoralizing, and visible swelling can draw unwanted attention or comments, leading to self-consciousness, especially in social or active settings. 9. Eye puffiness and dark circles. Many people on prednisone notice an exhausted or bloated look, specifically around the eyes, even if they've supposedly slept. This is partly due to generalized fluid retention as described above, where excess fluid accumulates in the delicate tissues around the eyes. It's also exacerbated by the disrupted sleep patterns and increased fatigue that prednisone often causes, contributing to more prominent dark circles and a perpetually tired appearance. Puffy eyes and dark circles can lead to people frequently asking, "Are you okay?" or "Are you sick?" which, no matter how well-intentioned, can feel invasive, irritating, and a constant reminder of one's medication or underlying illness. These visible changes, while generally not dangerous, have a significant emotional impact, especially for those already struggling with self-image and feeling unlike themselves while on the medication. It can feel like their face is betraying their inner struggle. 10. Gas, bloating, and digestive issues. Prednisone can be very hard on the digestive system, particularly the stomach and intestines. Many users experience a range of uncomfortable gastrointestinal symptoms, including increased gas, abdominal bloating, constipation, indigestion, dyspepsia, or even intermittent diarrhea. Prednisone can increase stomach acid production and reduce the protective mucus lining of the stomach, making it more susceptible to irritation, inflammation, and even ulcers in some cases. It can also disrupt the delicate balance of the gut microbiome. Socially, this is one of the most acutely embarrassing effects, especially if it leads to uncontrollable flatulence, loud stomach rumbling, or sudden urgency that requires immediate access to a restroom. It's uncomfortable to bring up with anyone, even a doctor, but it's a very common experience. The constant discomfort and unpredictable nature of these issues can significantly impact social confidence, eating out, and even close personal interactions, leading to feelings of profound self-consciousness. 11th, skin thinning and easy bruising. Prednisone profoundly inhibits the production of collagen, a key structural protein that gives skin its strength, elasticity, and plumpness. As a result, skin becomes noticeably thinner, more fragile, and slower to heal. This is often described as tissue paper skin because of its delicate, almost transparent quality. Minor bumps or even light pressure can cause large, discolored purple bruises, purpura, especially on the arms and legs, that seem to appear out of nowhere, often without any recollection of injury. These bruises tend to be extensive and slow to fade due to compromised capillary strength and impaired healing. This side effect isn't just cosmetic. It can lead to people worrying what others might think, especially when visible bruises are mistaken for injuries, abuse, or unexplained medical issues, leading to intrusive questions. Some also report paper-thin skin that tears or rips with minimal contact, e.g., pulling off tape, a light scratch from a pet, which can be painful, prone to infection, and agonizingly slow to recover, adding a layer of physical vulnerability and anxiety to daily life. 12th, stretch marks, striae. Unlike common stretch marks from weight fluctuation or pregnancy, prednisone-related striae tend to be unusually deep, wide, and strikingly purple or red in color. They usually appear in areas of rapid fat deposition or skin stretching, such as the abdomen, thighs, underarms, near the armpits, and breasts, and are a direct result of the skin stretching faster than its compromised collagen and elastin can adapt. The collagen-inhibiting effects of prednisone weaken the skin's structural integrity, making it less resilient to stretching. For many, these prominent stretch marks feel like a lasting visual reminder of their illness or treatment, a permanent change to their body that they didn't choose. Even after stopping prednisone, these striae often don't fade completely, remaining as silvery white scars. This can profoundly impact body confidence, particularly during intimate moments, when wearing certain clothing, like swimwear, or even just looking in the mirror. leading to feelings of shame or disfigurement. 13. Body odor changes. While not as universally experienced as some other side effects, a significant number of prednisone users report noticeable and often distressing changes in body odor. Some describe developing a strong, musky, sour, or distinctly chemical scent that doesn't go away with regular hygiene practices even after showering. This may be related to prednisone's impact on sweat gland activity, changes in the composition of sweat, shifts in hormone levels, which influence scent, or alterations in the skin's natural bacterial flora. This side effect, though often invisible to others at first glance, can lead to heightened self-consciousness, social anxiety, and a constant preoccupation with cleanliness. Individuals may find themselves showering more frequently, changing clothes multiple times a day, using excessive deodorants or perfumes, or even avoiding physical closeness or social gatherings for fear that others will notice the unwelcome odor. It's a deeply private and often isolating concern that can profoundly affect personal interactions. 14. Changes in libido and intimacy. Prednisone's profound hormonal and emotional impacts can also disrupt sexual health and intimacy, an area rarely discussed openly. Prednisone can suppress the body's natural production of essential sex hormones like testosterone and estrogen, which play a crucial role in regulating libido, sex drive, arousal, and sexual function in both men and women. Additionally, the myriad other side effects, including fatigue, body image changes, mood swings, and physical discomfort from pain or bloating, can further diminish desire and make intimacy challenging. Some users experience significantly lower libido, erectile dysfunction in men, or vaginal dryness and reduced sensation in women. Others struggle with emotional disconnection or feel unattractive due to the physical changes from the medication. This side effect is almost never discussed in doctors' offices unless the patient explicitly brings it up, but it's a very real and often devastating impact on romantic relationships and self-perception. Open, honest communication with partners and healthcare providers is essential to address this with compassion, understanding, and potential management strategies. 15. Brain fog and forgetfulness. Last but not least, prednisone can impair cognitive clarity, leading to what many users describe as a pervasive brain fog. Many report a distinct sense of mental fogginess, where concentration is difficult, memory lapses are frequent, and processing information or multitasking becomes overwhelming. Everyday tasks like recalling names, finding words, or remembering appointments can become frustratingly challenging. This may be due to a combination of factors, including sleep disruption, prednisone's direct effects on neurotransmitter activity, and inflammation within the brain itself, and the overall physiological stress of managing a chronic condition. While it may not be permanent, it can be incredibly frustrating, embarrassing, especially in professional or academic settings, and even frightening, as it can feel like a loss of mental sharpness and control. When others don't understand the cause, it can lead to feelings of inadequacy or being perceived as less capable, adding another layer of silent struggle. If this video resonated with you, give it a thumbs up and consider sharing it with others. By sharing this knowledge and fostering open conversations, you can play a vital role in destigmatizing the realities of living with conditions that require powerful medications like prednisone and empower individuals to advocate for their health with their medical professionals. Thanks for watching. And as always, stay strong, stay informed, and stay compassionate with yourself.